Hi, my name is Malaysia Walker. I am a nursing student at the University of South Alabama, and I will be doing a medicine administration checkoff today. As you can see, I am who I say I am, and now I'll be scanning my room. Okay. So first, I'll be making sure I'm in a no interruption zone by having all the doors closed, taking no phone calls, and having any limited conversation with my colleagues. Now I'll be comparing my order form with my MAR, which stands for Medication Administration Record. I'll be making sure that the information matches to make sure everything's correct. So, Jaguar J. Jones, date of birth, August 25th, 1963, August 25th, 1963, medical record number 4176352, 4176352, an allergy, allergic to penicillin. So now that I know that everything matches, I can put my order form away, perform hand hygiene, and now start on my first checks of my 7 rights of medicine administration. So first, right patient. My patient is Jaguar J. Jones. Right medicine. I'll be using Novolin R insulin, and also checking the expiration date as well. It is December 1st, 2025, and I will show you. Novolin R insulin, and the expiration date is December 1st, 2025 by 8 o'clock in the morning. Okay, right route. It is subcutaneous, and I have a subcutaneous syringe with the needle already attached. Right dose. My dosage is 10 units, and thankfully my syringe is in units, so I don't have to do any calculations, but if I did do calculations, I would have another nurse double check it to make sure it's correct. Now, I will clean my vial. Take off my cap. Drop back 10. Now I'm gonna pull back until it hits the 10 landmark. Okay. And now I will pull the safety up. Now, usually after I do dosage, I write dose, I would have another person double check my syringe to make sure that everything's correct, and that'll be you today. So, I hope you can see the 10. It is right where it needs to be. Now for right time. The administration is supposed to be administered 30 minutes before a meal. It happened a couple of hours since my patient's last meal, and it's approximately 30 minutes before my patient's meal time, so it all matches up. Now for right indication, this is to regulate blood sugar levels, which is especially important if the patient is diabetic. Now, for right documentation, which is something I would do at a later time. Now for my second check of the 7 rights of medicine administration, it's right patient, Jaguar J. Jones, right medicine, Novolin R insulin with a good expiration date, and there's Novolin R insulin in the syringe. Right dose, it's 10 units, as it says, and there is 10 units in this syringe. And I also look at dosage calculations on my vial as well if need be. The right route is subcutaneously. This is a subcutaneous syringe. The right time is 30 minutes before meals, and it is approximately 30 minutes before my patient's meal time. And right indication is to regulate my patient's blood sugar levels. And right documentation I'll be doing at a different time. Now I will provide a label for my syringe, putting the right medicine, right dosage, and the right patient, which is their name. So I will use this tape. Put it around this. Trying to make it equal, half and half. And write down using this Sharpie, Jaguar J. Jones. As it says on here, the medicine, Novolin R insulin, Novolin R insulin. And the correct dosage is 10 units. And I have made the label, as you can see. Now I would have moved to my patient's room. So let me move everything that I need. This is This will be my sharp container. As you can see, put the label on it. My gloves and my goggles. Okay, so I walk into the patient's room. I would have performed. I would have checked for the patient's check to see if it's the right patient using medical indicators, which I will use for their armband. So the MRA, Jaguar J. Jones, date of birth, August 25th, 1963, August 25th, 1963, and medical number 417-6352, medical number 4167-6352, and making sure that allergies match as well. Penicillin. Okay, so this is the correct patient. I would have told the patient the procedures, and it is administering insulin. So now I will have performed hand hygiene, raised the bed, lowered the side rails, moved the covers. I would have done any pre-administration assessment needed for the patient, and then I would do right medication. So I look at the MRA, Novolin R insulin. I look at my vial, Novolin R insulin, and I look at the label on my syringe, Novolin R insulin. I would do right dosage, 10 units. Right dosage on my label is 10 units. Right time, 30 minutes before a meal, and it is 30 minutes before my patient's meal time. And now I will be told my patient the right medication, which is to regulate their blood sugar levels. So now it is time for me to don my gloves and goggles. Wipe my patient in the wound area. And now my patient's route is subcutaneous, so I would be doing it in the abdomen and then the thigh as usual. And then for this one, I would like pinch the muscle. Oh wait, let me first lower the safety. So now I would pinch the muscle gently, and you would do it at either a 90 or a 45-degree angle. So gently but quickly insert, and then slowly press in and pinch as you're doing it, and then let go. And it is advised not to aspirate or massage after administration of medication. So now I would make sure that my patient is not in any pain. I would recover my patient, put them in the correct position, raise the side rails, lower the bed. Lower the bed. I lowered the bed. So now I would make sure that there are no allergic reactions. And now I would do right documentation. So I would use my MRI and this pen to write down what I need to, the timing, which is, I don't know the correct time because I'm not wearing a watch, but I would know the time, and then the patient, and then the dosage. So now I can take off my gloves and goggles, and if there was a trash can, I would be doing glove to glove and then skin to skin. And then I would now leave my patient's room.